Well, good morning, everyone. Welcome to another live this morning. Hope you're having a great start to your day. We sure appreciate you guys coming on with us. And of course, this is question and answer day today. Mike, how are you, buddy? From Norland. Up first on the hit parade this morning. Here we go. Lori Lee, Ventura, California. And Sandy from Minnesota, Andrea, Niagara Falls, and there's Brahim, numero 4, Brahim. Wendy, Wasaga Beach, Adeline, good morning. And Mary from Norwich, nice to have you on. Nick from our staff. Cecilia, Shediac, Nouveau, Brunswick, Dave from Muskoka. There's Kevin from Oshawa. Donna from Park Hill. Good morning. Faye from Quebec. Marilyn, how are you? Nativity. And Donna, how are you? And Joni, Alliston, Karen, Sue, St. Marie, Gloria, New York. And Brahim is saying hi to Kevin. Dennis, Oakville. Nicole, how are you? And Georgie, Halifax, Nova Scotia. Carol, good morning from Mount Pearl, Newfoundland. Brenda, Walford. Doc McEwen from West Tennessee. Jean, Peterborough. Francis, good morning from Vaughan. And Bobby. And Helga from Scarborough. Star, how are you? And Karen, Peterborough. Lori and Ryan from Sarasota, Florida. Madeleine, good morning. Chantal, bonjour. Norma, sunny Texas. Bonnie, Blenheim. Sandy, Chilliwack, British Columbia. Yvonne from Petawawa. Margie, Kansas. Good morning. Lorraine, BC. Nancy. And Fran. I missed you, Fran. I didn't mean to. Marlene. Good morning. Mary, PEI. And Sue, how is you? Cecilia, good morning. I like it. You guys are saying hello to each other, too. Carol in West Virginia. Sharon, a hot one in Kansas. Norma, Burlington. Oh, Brahim is 44th anniversary today. Well, good for you. Marianne, happy anniversary. Well, to Brahim. Sue. And Wendy from Markham. And folks are saying congratulations to Brahim. Hi, Lise. Bonjour, Carol. And Judy. So, folks, I like that, guys, because you communicate with each other too. You know, we've been around for a bit, and our little crew here, we like to stay in touch with each other. Yeah, okay, guys. Okay, let's get to the questions this morning, and great questions. Grace, what do you think of cauliflower crust? Yeah, I like it. I mean, it's better for you than, like if you make a cauliflower crust or cauliflower pasta, better, not near as starchy, not near as, not the amount of insulin that you would need to break down ordinary pasta or whatever. Yeah, I like it. Okay, I like it. It's good for you. Got no problem with it. Okay? Kathy, what are your thoughts about using liquid chlorophyll? I like chlorophyll. Yeah, I like it. It's good for you. It's a good antioxidant. It's a good detoxer. I remember in the 70s using chlorophyll, and we had a prof at school. He thought chlorophyll was for everything, from warts on your nose to bacteria on your toes. He just thought chlorophyll was good for everything. And I remember I loved that prof. He was such a good guy. And Dr. Lee. And man, the guy was a smart guy. But he loved chlorophyll. And, if he loved it, so did I. Okay? And yeah, it's good. I like it. Okay. Carol, my naturopath mentioned that only certain kinds of curcumin in a liposomal formula will help with inflammation. No, I don't agree with that. I like curcumin, as you guys know. I talk about it quite a bit. Our curcumin is probably the most bioavailable curcumin you can get. And I've proven it to thousands of patients over the years how good it was for them. And the proof was in the pudding. So I like liposomal. It's another way of delivering curcumin, but it's not the only way. It's not the only way. And ours has a ratio of pepper, because you need that to absorb curcumin properly. Now again, just remember there's a difference between turmeric and curcumin. Curcumin is an extract of turmeric, and curcumin is the one that gives you the most benefits. Turmeric is good, guys. It's a wonderful spice, but therapeutically you need curcumin to be especially anti-inflammatory. Good question, Carol. Thank you. Diane, what can you do with a hernia under the liver? Well, generally hernias need to be operated on. And today they're so good at it. It's usually, it's laparoscopic. It's not invasive. If it's a minor hernia, sometimes they will repair themselves on their own, but generally you need surgery for a hernia, especially if there's, any kind of the bowel sticking out or whatever. You got to be careful with that. Mary, for genetic high cholesterol, yeah, how many DHA upgraded to keep triglycerides low? Well, I'm glad you put that down. Okay? I'm glad, Mary, you mentioned that, because you said, well, I got genetic high cholesterol. Okay, so what? Right? But you asked the right question. What do I do to lower triglycerides? High DHA lowers triglycerides. Vitamin E, steel, sun, steak, and steel help to lower triglycerides. Sun, steak, and steel, okay? And I would use at least a couple of capsules of high DHA a day, because it's been proven to lower triglycerides, okay? Now remember, let me just give you 2 seconds of reminder, okay? Triglycerides are fat balls, okay? And they're only produced not by fat, by carbohydrates, by sugars, okay? So what is dangerous in the bloodstream is when your triglycerides are too high, especially in comparison to what your HDL cholesterol is. I always like to look at numbers with those two, triglycerides and HDL cholesterol. And if you understand how your body works, when you're eating too many carbs, your triglyceride count's going to go up. So You can't out-supplement a bad diet. Cut out the carbs, your triglycerides are going to come down. And when you eat the right foods, your HDL will go up, and that's what you want. You want your cholesterol to go up, especially HDL. Okay? Because HDL hitch their wagon to triglycerides and bring them back to the liver for processing. Okay? So, good question. We appreciate it. Thank you so much, Mary. Ruth, she has Dupuytren's contracture, and it's painful hand cramps. Yeah, okay. Now, usually Dupuytren's, okay, you can see my hand will occur. We call that trigger finger, okay? So you get a finger, and I've seen patients where their last two fingers were, it's a calcification of the tendons, and they call it Dupuytren's contracture. Oh, give medicine credit for making everything confusing. And give it a name, okay, that nobody can pronounce. I hate that. But anyway, that's the world in which we live, okay? So that's what it is. And listen, here's me, okay? I always have said this. Dupuytren's contracture, okay, where you get calcification of the tendon in your hands, okay, can be very painful and is usually what I call diabetes of the hand. I usually saw it with insulin resistance. And patients found, because diabetes can come in a lot of areas even before you're really a diabetic, okay? What do I mean by that? Well, diabetes is the last thing to happen in your body. It's not the first thing, it's the last thing. And I always teach you this because your body is dedicated to keeping your blood sugars low. Okay? I got a question somebody's asking me about blood sugars, and we'll go into that. Your body dedicated to keeping your blood sugars low. You can't have sugar in your bloodstream other than if you take 5 liters, you might have a teaspoon there. Why is that? Because your sugar is toxic. And often, before your blood sugars hit a certain level, let's say 7, okay? Then the doctor, oh, you're diabetic. Well, yeah, but way before that, your body was giving you clues that you and carbs and you and sugars weren't getting along. That can happen on your skin. That can happen on, you see dry skin and patches, elbows and your heels and all that. Your body is telling you that your sugars are high, even without being diabetic yet. And arthritis, a lot of times it's the joints are diabetic before you officially are. Dupuytren's contracture. I've talked to you about AGE in the past. Glycation, that's what that is. It's a glycation. A calcification of the tendon. A lot of times it's food, guys. I'm not saying every time, because sometimes, you get people and they're using their hands for work or whatever, and they can get this. But generally, I found that happens in people that consume too much sugar. So watch out for that, okay? And one of the ways to treat it too is to get at it yourself. Like you'll feel that tendon, take a little bit of cream and rub the stuffing out of that thing. Get it going. Get it going. Okay, Ruth, thank you. Judy, what are your thoughts on aerobic oxygen in small amounts for killing yeast? Well, look, I don't know. Okay, I don't know. That wasn't really my area of expertise. Yeast was, but not aerobic oxygen. Okay, for me, the best thing for yeast. Okay, the Trojan horse. Don't feed the bears. You can use all the oxygen you want. That ain't going to kill yeast if you're feeding it. Don't feed it. It lives on sugar. Here we go with sugar again. Don't feed the bears. Oil of oregano, very good for fungus. Broad spectrum probiotics, especially with L. reuteri and L. rhamnosus. They are strains that go after yeast. So I don't know so much about the oxygen. I never used it, to be honest, in my office, so I don't know. I don't know. Margaret, I make my own cheese. Well, Margaret, you're a smart girl. Good for you. From fresh raw milk, and the recipe I use has citric acid, which is good for you, and sodium citrate in it. That's good for you too. Citrate means it's been chelated. Good for you. What are your thoughts on those two ingredients? Very good. Very good. And cheese, that cheese is really good for you, Margaret. You make your own cheese? Good for you. Ah, excellent. Eggs, meat, and cheese. Yeah, and there are better cheeses, just like there's better meat. All meat is good. Some are better. And steak is the best. Okay? Cheese is the same. All cheeses are good. Some are better. And you probably, Margaret, are making the best. You make your own. Good for you. Diane, what do you think of apple cider vinegar to increase stomach acid? Yeah, I like it. You think yours is low? I like it. I like digestive enzymes too. I really do. Okay? And somebody else was asking about apple cider vinegar. Let me just see if I can find it here. I would like Dr. Martin's opinion on taking apple cider vinegar pills instead of the liquid. Yeah, probably good. I wouldn't think quite as good as the actual liquid, but yeah, if you, I got no problem with that. Okay, that was Kim. Okay, let's get back here. And Margaret makes her own cheese. Diane's asking about, and Diane and Kim about apple cider vinegar. I like apple cider vinegar. Cindy, I like your question, Cindy. Cindy says this, okay? If sugar is so toxic, why did God make it? Why did he create it? I loved eating sugar cane as a kid. Yeah, okay. And I've answered, Cindy, I've answered that question. I don't mind to answer it again. Okay. So, when I was a kid, okay, go back to the 1950s. Okay. Does that make me old? Yep. Go back to the 1950s. This is just health history, nutritional history. I'm teaching you something. When I was a kid, Canadians and Americans consumed 25 pounds of sugar a year. It probably was too much, but it was 25 pound. You know, you get a 25-pound bag of sugar, in a year you would consume that. My 4 kids were all born in the 1970s, all 4 of them. They were consuming 50-pound bags of sugar a year. 25 in the 50s, one more generation, they were at 50. You know what it is today? It's 200 pounds. Every 10 years. Every 10 years, Cindy, you're eating a ton of sugar. A ton. A ton. Our bodies weren't meant for that. Our bodies were never meant to consume. Yeah, you had a little bit of sugar cane as a kid. You liked the taste of it, and good for you. That ain't going to kill you. But 200 pounds of sugar a year will kill you. And I'm not even talking about all the carbohydrates that are converted to sugar rapidly. Your pancreas was never designed for that much sugar. And that's why 93%, Cindy, of the population have a condition called metabolic syndrome, which is at the root of cancer. It is at the root of heart disease. It is at the root of Alzheimer's. Remember, Alzheimer's is type 3 diabetes. And my dad taught me something when I was a kid. Okay? I was in high school. My dad came home, my hero. I'm a diabetic. Ew, what's that, Dad? Well, it's sugar diabetes, son. What? Well, I can't have any more sugar because I got sugar diabetes, because that's what diabetes is. And so God created, well, first of all, God didn't create what man has done to sugar nowadays. They've taken sugar and made up a man-made sugar called high fructose corn syrup. It was made in a lab. It's made in, it's contained in a vat. And it's the antichrist of sugars. Okay? So, your body is dedicated to keep your sugars in your bloodstream low. You could have 20 glazed donuts. Now, I don't want you to do that, Cindy. I don't want you to do it. But it's been done. 20 glazed donuts. Take your blood sugar, skyrockets to above 20, probably 30. But within an hour or less, it's down to normal. Why is that? Because your body knows you can't allow sugar from the donuts and all of that turn to sugar pretty well. Your body can't allow that to stay in your bloodstream. It's so toxic. So it takes sugar out. So if you want to have, and you're in good shape, you're not part of the 93%, have a little bit of sugar. Did I tell people they can never, ever, ever, ever have an ice cream cone? It's their birthday, okay? But you got to listen about this, because this is really important, that when you have metabolic syndrome, you're a carboholic. That's what it means. And the process to health is not moderation. The process to health for someone with metabolic syndrome is elimination. I always tell people, you do the reset for 30 days, you watch what happens, because you're not going to have any sugar for 30 days. Okay? You're not. And you won't believe how good your body will be giving you high fives. Big time. Okay? Cindy, we appreciate the question. It's a good question. I like that. I mean, we should be challenged. Okay, we should be challenged. What Joyce is asking, why is it when you hit the age bracket of over 60, your body all of a sudden wants sugar? Well, that's probably, Joyce, you. Not everybody else. Although, listen, sugar's very attractive, right? I've talked to you about this before. It is more, it's more addictive than cocaine. And look, hormonally, digestively, you're getting older. Sugar is a quick fix. It's just a quick fix. And a lot of times your body will crave it. Okay? And it's, one of the things that I teach is the 3 Ds: desire, determination, and discipline. I talk about those 3 Ds. I don't think I've ever written a book that I didn't mention them, because it really does characterize a disciplined life will be a successful life. You need discipline in every area of your life. And today, especially in food, you got to be disciplined, determined. Desire is good, but you got to have the other 2 Ds with it. The Apostle Paul said, I beat my body. I disciplined myself. I watched my father with diabetes discipline himself. He understood it. Even when they were teaching different, nutritionists were trying to tell him moderation. He said, it's not moderation, it's elimination. I learned that in the 1960s. It's sugar diabetes. So my dad, who loved sugar, said, I can't have sugar. My dad ate steak 6 days a week, and I'm not kidding you. My mother got the memo, and my dad ate steak. So, guys, I'm telling you, okay? Okay, Susan, how can you know if your enzymes are all in good levels and working optimally? Well, if you're very, very healthy, Susan, if you've got, you break down your food, you don't have acid reflux, your bowel is working tip top, and you have no deficiencies. I mean, look, you want to know about enzymes? Check your B12. Because you need the intrinsic factor. You need your stomach to be working very, very well with high acidity in the stomach and enzymes. Because some people, they just can't digest certain foods. And if you're not in that category, I would tell you, Susan, that you're probably in good shape. I'll tell you something, though. When you hit a certain age, okay, you'll find out that you're probably not making as many enzymes as you used to. So just with age, okay, I love digestive enzymes. I take them every day, okay? And, but that's how generally you know. Like if you get your blood work done and you see your B12 is good and, generally you can tell that, your enzymes are pretty good if your B12 is good, because that is a finicky vitamin to absorb on the best of days. Okay? But all of the things that when you're eating, I don't feel good, this bothers me, that bothers me, there's a good chance your enzymes are not up to snuff. Okay. Susan, another one. There's another different Susan. Well, that's to be expected. I had a hysterectomy and my ketones are 1.5. So I finished the reset. Should I be concerned? No. I probably need that question rephrased, Susan. You finished the reset and you got ketones in your urine. There's nothing wrong with that. You're burning fat as fuel. That's what it means. Now, there's a condition that's dangerous called ketoacidosis. Not the same thing at all. Often happens in diabetics where they become, they get ketoacidosis. That is very dangerous. That can kill you. That's not ketosis. Ketosis is your body's burning fat instead of carbohydrates. It's a better fuel to burn. So I'm not quite sure, Susan, the question. You might want to rephrase it to me. Send it to me again at info@martinclinic.com. Info@martinclinic.com. It'll get to me. So rephrase that question if I didn't answer it properly, because I'm wondering what you're trying to ask me there. Kevin, can you take vitamin D without worrying? Oh, chronic kidney disease. Okay. If you have chronic kidney disease, can you take vitamin D without worry? Yes, if you take it with vitamin K2. That's why we put K2 in our vitamin D. I wouldn't take vitamin D without K2. Now, you can go in the sun. That's different. You don't need K2 when you're in the sun. And by the way, K2 is found only in the animal kingdom. When you eat eggs, meat, and cheese, you got vitamin K2. Okay? But if you have chronic kidney disease, then you want to make sure you're taking vitamin D with K2. Okay, that was a good question. As well, other than repeating EMC, is there anything to do with the parathyroid for chronic? Yeah, because look, you with chronic kidney disease, you don't want calcium sitting in your kidneys. Okay, that's why when you do the reset, it's actually very good for chronic kidney disease because you're not having any sugar. Sugar destroys your kidneys. Protein doesn't, sugar does. And vitamin K2 is key to taking calcium and putting it in the, and putting it where it belongs, sorry. And my nose is running continuously. Okay. You got a fungal infection in your sinuses. I'm 100% convinced of it, Anne, even if I haven't seen you as a patient. When your sinuses are continuously running, you've got a yeast infection in your sinuses. Came from your gut originally. The Trojan horse got into your body. Maybe after an antibiotic. Okay, this is the usual way it happens. And a lot of times it happens after a sinus infection. You get a sinus infection, you take an antibiotic, and you kill all the friendly bacteria, not only in your gut, but in here. And you know what happens? Yeast comes in. Chronic yeast. It loves moisture. You know why? Because yeast is a cousin of mold. Where do you find mold? In my bathroom, in my basement, right? Yeah, moisture. Sinuses, moisture. Yeast thrives there. Oil of oregano, fantastic. Probiotics, replace replenish, regenerate. Okay. Yeah, I love oil of oregano. Okay. See if we can do a few more here. Janice, my 11-year-old son usually has enlarged tonsils and tonsil stones. Well, the reason is, okay, tonsils are there. They're trap doors. They're actually with your, is it your son? Yeah, your son, Janice. His tonsils are actually working. Okay? Working. Now, when you get stones there, okay, and one of the things that I like, and 11-year-old, you might have trouble convincing them, but oh boy, a gargle with oil of oregano, like diluted, and really, really good for that. But you know what? Your son's tonsils are working. Okay? They're working. I know sometimes you can get tonsillitis. It's not fun, but that's their job. When I was a kid, I think it was grade 7, the teacher said, who's got their tonsils? I looked around the room. I had my hand up. I was the only guy that still had my tonsils. That night I asked my dad, how come I still got my tonsils? All these kids went to the hospital to get their tonsils out, and they got a Dixie cup ice cream. I said, I want that too. And my dad said, you need your tonsils. They're good for you. They're a trap door. They protect your esophagus and your trachea. They don't let anything get into your lungs. Oh, yeah. Because we were being taught tonsils were useless. They were part of evolution. I got taught that in school. And now, you know what? They wouldn't take your tonsils out just about if your life depended on it. You could have gangrene in your tonsils, and doctors want you to keep them. Why? Because they finally woke up. Tonsils are part of your immune system. They're trap doors to keep bacteria and viruses out. You got stones? Gargle. Oil of oregano. Because they don't kill your... Oil of oregano is nature's antibiotic because it doesn't kill your good guys. It only kills the bad guys. How do you like that? Okay. Janice, okay, let me see. Let's do another one. Bone density shows a 4% loss since the last test in 2023. How serious is this? Enough to go on Prolia? Well, look, Pat, I can't tell you whether to go on a bone building medication. Personally, I don't like them. Personally, they're building the wrong thing. And you're anyway. Look, I'm not big on it. I'm much bigger than, look, it's normal to lose some bone density as you age. That's why I'm very big on sun, bone, steak, bone density, and steel, muscle. Muscle is a metabolic wonder. What it does, not only for your blood sugar, what it does for insulin, what it does for insulin resistance, what it does for your bones. There's nothing better for bones than muscle. Get strong. Get bands. Whatever you can do. Believe me, that's better, 1,000,000 times better than medications that they want to give you. Okay? 1,000,000 times better. Now, you want to build bone? steak. I love our multi-nutrient for building bone. Everything is in there. From boron to selenium to you name it is in there. Even a calcium citrate. I don't like calcium unless you eat it. But in the multi-nutrient, I put the citrate because you're absorbing that with vitamin K2. It's in there. And as a nutrient, it's like eating when you take that multi-nutrient. Because that's what it is. It's a multi-nutrient. Okay? And so, I'm big on you getting strong. I'm big on nutrition for bone. And I'm really not big on, because I've seen it over the years. I never seen it really work. These bone builders, so-called bone builders. I have never seen it really work. A lot of advertisement, a lot of ink, but I've never seen it to be that effective. Much better eating steak, cheese. Okay? Okay. Well, I think we better stop, and I'll try and finish these on Monday. Yeah, we got a fair amount to go. So, yeah, we'll do this on Monday again. Here we go. Question and answer Friday and Monday. Hey, guys, I mean it. Ask any question you want. I like them. We answer our questions. Okay? And we'll get to the rest of them on Monday. And if you got questions, don't be shy. Okay. Guys, we love you dearly. We'll talk to you soon.